Sorry about that. I think we're just getting started here. My name is Ted Hart. I'm the President and CEO of CAF America, and welcome to our webinar today. Let's move on to the next slide. "192 countries around the world are already affected by the coronavirus global pandemic, many in dramatic and heart-wrenching ways. Still others are bracing themselves should their emergency services buckle, as services have in countries already badly affected. It is increasingly clear that governments, central banks, and the WHO will not defeat the coronavirus alone. The private sector will play a key role if victory is to be won. As the many layers of the COVID-19 crisis are unfolding in front of our eyes, on the front lines are charities providing direct relief on the ground where it is needed most, and right alongside them are the philanthropic donors, foundations, and corporations who support them. In the eye of the storm, as infection and death rates continue to soar around the world, we bring you this webinar. Three of CAF America's dearest friends and three of this country's most outstanding corporate philanthropic managers join me today to provide authentic insights into the journey they and their staff are taking, with efforts already underway as they mobilize funding around the planet and right here in the United States at an unprecedented rate. Together with hundreds of other fund holders at CAF America, they are catalyzing the impact of COVID-19 response. Our experts today are Sylvia Cruz Vargas, Director of Social Impact at PepsiCo Foundation. Next slide, please. Christina Fontana, Senior Manager, Global Corporate Giving at Edwards Life Sciences Foundation. Next slide. And Anne Vella Wagner, Executive Director of the Mars Wrigley Foundation. Next slide. CAF America is a U.S. public charity. We provide services to individuals, foundations, and corporations who make charitable donations domestically and internationally around the world. Everything that CAF America does comes back to what we refer to as the 3 R's. Regulatory compliance with relevant legal frameworks in the United States and Canada, as well as in the grantees' home countries around the world. Risk management of international grant making. Let's please go back to the prior slide, please. Just wrapping up here, reputation protection from the inherent risks of cross-border giving. Now we can go to the next slide. CAF America is part of a global alliance. We have a world reach that allows us to provide services around the planet. We have 1.8 million rather eligible organizations around the world. And with our donor partners, we have granted more than $1 billion to charitable efforts around the world. Next slide, please. We have scanned and worked with many of our corporate partners, and what we are seeing in terms of corporate donor response are some of the following. Donors are redirecting existing grant programs. They are developing new programs, allowing employees to nominate organizations to receive direct relief in response to the global health pandemic. They are increasing funds committed to COVID-19 specific relief initiatives, and they are showing flexibility with existing funds, with existing grants, to make it possible for charities to succeed. Next slide, please. We're now going to invite in order our experts today. Again, folks who are on the front lines of funding. First, I'd like to invite Sylvia Cruz Vargas, the Director of Social Impact at PepsiCo Foundation, to share with us a bit of the journey that you've been on, helping those who are listening and will benefit from this webinar to understand what is PepsiCo doing, how are you making decisions now here in the eye of the storm.
Thank you, Ted. Good afternoon, everyone. I'm Sylvia Cruz Vargas with the PepsiCo Foundation. The PepsiCo Foundation, first, for those of you who have not been introduced to our organization, was founded in 1962. And since then, we've been working and investing in the essential elements of a sustainable food system. And we work on helping to alleviate hunger, managing water and waste responsibly, and supporting women to drive economic growth and food security. That is our day-to-day job. By doing this, as this slide reads, our tagline is "We feed potential," and that's what, as a food and beverages company, we seem and strive to create. Next slide, please. On our day-to-day basis, we focus on four priority areas. First, in the area of water, we provide access to safe water and sanitation services to those at most at risks in geographies that are water stressed around the globe. In the topic of women economic empowerment, we provide with women, especially those that are part of our supply chains, as well as the food system, with the tools that they need to advance training and other types of skills that are so needed right now. In the area of waste, we work on waste management as well as recycling practices to provide local income opportunities. And what brings us all together today, which is at the core of what we do at PepsiCo and in our DNA, is nutrition. And we try and we really do a good job at striving to help alleviate hunger and investing in solutions to address food insecurity, which in this unprecedented time is so needed. Next slide, please. And how we do our work on a daily basis also reflects how we are responding to today's challenges. But we focus on three priorities to make sure that we can augment impact as much as we can. On the first topic, we focus on systemic solutions, and we usually try to look beyond our borders to address the topics that we have at hand. On the second priority is PepsiCo has more than 260,000 employees across 220 countries and territories. Our employees are our most precious asset. So we always try to bring them in the journey of our philanthropic giving, as well as what we try to do during this time of need. And last but not least, we have always realized that we cannot do it by ourselves. We need to catalyze capital and look for other donors to augment results in any of the geographies in which we work with. During disasters or in regular business as usual hours, we are always trying to look for others to help us augment the impact of leading organizations on the ground. Which brings me to the next slide and talk a little bit more in broad strokes as to how our company is reacting in the wake of this emergency. And similar to what Ted echoed in his opening comments, we are mobilizing resources to provide food, water, and other critical supports to communities affected around the globe. The first thing that we are using as a principle, which sometimes we're not so encouraged to do, is over communicating with that network of employees around the globe to partner with leading organizations on the ground and augment their impact. As I previously mentioned, we have a very healthy network of employees that are on the ground creating impact, and we have created a global response towards the provision of food and essential goods, but we are tailoring that response locally to ensure that it's relevant independently to the country in which we are working. We are also catalyzing capital. We're calling other donors, friends, our franchise network, our retailers, our suppliers to join our efforts and fund the same organizations we're funding to augment our own impact. And last but not least, we don't want to underestimate the generosity and passion of our own employees. And we will be launching a much robust and compelling employee program tomorrow to support the same partners that we are supporting on the corporation to enhance their reactiveness and their response on the ground. I want to close with two large examples. One is, of course, in the United States, we have a nutrition arm at the PepsiCo Foundation called Food for Good. And through that nutrition arm, we are working with partners to deliver more than 1 million food boxes to students across America. But as I'm sure many of you know in this call, one of the populations that are most affected by this particular situation are children and seniors that are out of school. And we have tried to find the right stats to say that uh, the United Nations approximately says that nearly 1.7 billion children are affected by COVID-related closures, school closures. And internationally, we are also tailoring our response to make sure that we focus on the provision of meals to those that need it the most. That's it on my part. I invite the next speaker to share the thoughts.
And our next speaker today is Christine Fontana, Senior Manager, Global Corporate Giving at Edwards Life Sciences Foundation.
Great, thank you, Ted, and everyone. Thank you guys for hosting this conversation today. And really, I'll say thanks to everyone for being here today. I really can't articulate, as I was thinking about this opportunity, how impressed and supportive I've personally felt from our global community of corporate philanthropy peers over the last few weeks. I think people are being really transparent, and people are being really creative, and they're being really generous. And it's a little bit of brightness in a moment of a lot of need. So I appreciate it. So as Ted said, I'm Christine Fontana with Edwards Life Sciences Foundation. Just a little bit of background. We are a medical technology company. We are the world leader in devices for structural heart disease and also critical care and surgical monitoring. We're based in Southern California, and we've got about 14,000 employees globally in over 30 countries. And our annual giving was 11 million last year, just to give you some context. So first, I want to tell you a little bit about some of the themes that we've been focusing on and leveraging in our COVID response plans. And then I'm going to turn to more specifics about what we've done so far in our initial response. I also will just call out, I love this quote that's up on my slide from Secretary Guterres about bridging divides and focusing on trust between partners and common goals. And it's something that was honestly particularly inspiring to me as we started to think about this initial response that I've outlined some of the themes of here. So one of the most important things here, I think, is something that's always important in giving, but really heightened now, and it's listening and talking to our partners and be super focused on serving them. I think this is a time, for lack of a better word, for being even more selfless than I think philanthropy sometimes is, and really advancing with trust and giving with what is absolutely imperatively needed. We're trying to be really open with our partners. We're trying to be really open with ourselves and also our executives internally that needs are changing pretty rapidly. So for an example I'll share on that is that we were getting ready to present a grant response to our CEO and board of directors last week. And a day before we were going to present, we had decided that India and Japan didn't need a focused support because we'd heard on the ground from partners and employees themselves saying, really focus on, Italy or Spain or other places of high need. And that obviously quickly changed, and we are tweaking our response and giving ourselves grace and being flexible as things continue to evolve. We're also really relying on trusted partners and our networks of leaders. So this is more of a time than ever, I think, to tap into our network and get quickly a pulse on what we can do. We are really relying on our local employee leaders, our executives, industry associations like ACCP and Council on Foundations, and of course, CAFA. We are really focusing on our trusted partners on grant recipients. So we're not looking to necessarily form new partnerships right now, but we're working with partners that we have existing relationships with and working with maybe their global affiliates of organizations like We Trust, or partners that have a trusted common relationship, such as an organization that CAFA's maybe worked with, but we haven't directly ourselves. I will also call out that CAFA's list of orgs responding to the disaster has been an incredible asset that my entire global team has been looking at. So we're also taking this approach of let's act fast and do something to get money working directly as quickly as possible, but we're also really thinking deeply about long-term response. So what's going to happen in the next 4 weeks? What's going to happen in the second half of this year? How are we going to adapt philanthropy strategy for longer run? And whether that's kind of more frontline support or more economic recovery. We're trying to think both short and long term here. And then the last theme that I would mention before getting more specific is to think about really minimizing your operational requirements for the grant partners that you're working with, while also ensuring compliance. That's something that we're really trying to work on. So for the initial grants that we're getting out the door, we're doing a really bare bones 3-question application, general terms and conditions, limited impact reporting. And we can do that because we are trying to work with trusted, established partners. So next slide, please. Let me turn to more tangibly what we've done with our initial response to date. So we're advancing 3 different programs with a focus on supporting charitable organizations that are both on the front lines working with COVID, and then also on the other side dealing with economic hardship for safety net, the increased demand on the safety net. So first, we issued $1 million in new funding to trusted partners in markets where we live and work, where there's a need. Which is most of them right now, right? We made 17 grants in 14 different regions. And for us, these are larger grants. So the minimum was $25,000 and we're going up to $100,000, which for us is larger. These recommendations came from, I would say, kind of an array of input, but it wasn't democratic. It was something that we pushed through as quick as possible. This entire process for us was about 7 days. And now we're focused on getting those grants out the door. The second thing that we're doing is allowing for changes and lessening the restrictions on existing grants that are already out there that are working. So if we have a grant partner who is going to, say, run a baseball mentorship program for underserved kids in India, we're taking that money and we are repurposing it to make sure that they have the approvals that they need to focus on perhaps feeding those families instead. We also do a lot of medical philanthropy, as you can imagine, and so a lot of our partners are not able to advance their planned humanitarian missions in developing countries. So we're changing those funds and letting those either focus on COVID patients or thinking about other ways to continue to support their existing patient population using such things as virtual education. We have a change of grant application process set up that we developed in partnership with CAFA for the grants that are applicable. And so that's been really helpful in helping us to kind of do this as quickly as possible and loosen up those restrictions. And then the last thing that we're doing right now in our initial response is what we're calling expediting regular funding. So we usually give in an annual grant cycle, but many partners we support year after year. So we're fast tracking those grants now. We're focused on the safety net service providers and getting them funds into their hands as quickly as possible so those funds can start to work and meet their urgent needs now. Next slide, please. So I do just also want to mention, in addition to grants, the other things that we're doing. So we just heard some good examples on Pepsi's response, and I think we're always reminded by the articulate Melinda Gates about giving more than just grants and dollars. We are also expediting medical product donations of technology that we have that can help to strengthen ICU capability. So we have monitoring equipment that can really help, and we're getting those out into the hands of developing economies. And we are also having our volunteers, our medical volunteers, provide virtual training to ICU staff about how to integrate that into their need. And then we're also really thinking about our employee volunteers. So we have an incredible culture of giving. We've got about 14,000 people, 30 countries. And so they are helping with online drives with local organizations, such as virtual food drives. We're also recommending to employees where they could donate and making sure that we're matching all funds that they are donating. And then we're also doing some pro bono virtual volunteerism through things like Catch a Fire and Taproot, which are awesome resources to be promoting and sharing. So that's lot of information on kind of our initial response that we're making at this time. Happy to take any questions when we're ready, and I'll pass it back to you, Ted.
Terrific. And our next presenter today is Anne Vella Wagner, Executive Director of the Mars Wrigley Foundation.
Thank you, Ted, and hello, everyone. And thank you for sharing your amazing work, Christine and Sylvia. Really, really great things to learn about today. I'd like to tell you a little bit more about Mars Wrigley and the Mars Wrigley Foundation. Mars Wrigley is the business that leads some of the most iconic candy brands around the world. It is one business unit of Mars Incorporated. So I will just be speaking specifically to Mars Wrigley and our philanthropic response through the Mars Wrigley Foundation today. Worldwide, we have 34,000 associates globally that have been, directly impacted, as we all know, as we all have been through this current situation, through the foundation's work. I want to share more about our mission because at its core, it really focuses on creating better communities. And that's what we really want to do here in our communities around the world, knowing the significant challenges that they currently face. Next slide. When a disaster occurs, we've all been in this situation in the past. We look at our basic consideration sets, and recognizing that we've not been in the situation that we are in now in the past, but a lot of these considerations do translate. Looking at it in terms of your focus area, your approach, in terms of meeting, is it the immediate or long-term needs, how you'll engage, and identifying the appropriate resources and expertise that you uniquely, can provide and bring to the table during this time, and engaging with the appropriate partners. And, you've heard from Christine and Sylvia already some really, really great examples specific to their industries. So each organization needs to define when and how they will engage. And this is no small task. In terms of just the standard, natural and man-made disasters that we've been seeing occur at a regular place globally. Next slide. But however you've defined, your process in your engagement strategy in the past, what's become apparent now is that it definitely needed to change, that there was some adjustments that were going to need to be made. And our current health crisis is not isolated to a specific country or even a region. So just the scope in and of itself has increased significantly. We have operations in China, so that was our first point of engagement. And as that progressed, I realized, this was a very unique situation, and continued to monitor and rely on experts. So like the World Health Organization, the CDC, and as you may recall, the WHO was truly sounding the alarm on this, early on. So recognizing this, we knew our disaster grant making approach would need to shift in accordance to the situation. And I developed our strategy recognizing that the pace of the virus spread and related needs and supports would vary by geography. And again, you've heard examples of that already on this webinar. So then looking at it in terms of our focus areas and the community lens that we apply to our work, really determined that our focus would be to support the local needs in our site communities, and that we would activate this globally. And this is the first time we've operated this type of a global response. And so I realized we need a streamlined approach to our grant making to facilitate, expedite it as a process as possible, while maintaining the appropriate governance process. So especially for those that that lead corporate foundations, you know that there are specific considerations as part of that process. So I had conversations with our foundation board early on to set the overall funding level, and then secured additional approvals to broaden the scope of my grant-making authority to ensure we'd be able to expedite our internal process. So I do encourage everyone, if you haven't already, to really look at, you know, what does your internal process look like, and what are some of those adjustments that you can make to really be able to respond quickly. And when it comes to key stakeholders, you know, we all have expertise in managing our partnerships. You know, I would like to call out the need to engage with your existing partners and grantees, regardless of the focus areas that you may lead on. All of them are impacted in one way, shape, or form if they're not directly on the front lines. I proactively, you know, connected with our partners to reset expectations, offer reassurance that we would remain flexible with any work or programs we were launching this year, and, you know, adjust as necessary. And it was a great opportunity to really learn from our partners and understand where they were in this current reality, and talk about any urgent needs that they may have. So again, you know, echoing what Christine said about trust, it's so important at this time in having those transparent conversations with our partners, because this is new for us all. You know, I realize this is an opportunity to learn, and we're going to refine as things move forward. Next slide. So we are now in the midst of activating our plan, which currently stands at a $3 million commitment from the foundation. It began with our initial response in China, as I mentioned. We provided support for personal protective equipment for frontline health workers. But our support looks very different in terms of our global headquarter community in Chicago. We've supported the Chicago Community COVID-19 Response Fund, which is a model many cities are establishing to pool major funding. It allows both, you know, a flexible response because the needs are evolving constantly. And, you know, responding to those needs, especially for the most vulnerable in our communities, is so important. And this has really been a best practice in a lot of the major cities. I believe it started in Seattle when they were hit very hard earlier on. And so I do encourage to support these types of pooled funds where available. And as I mentioned, we've streamlined, you know, an emergency grant request process. So domestically, we'll be supporting our site communities throughout the U.S. Through the Mars Wrigley Foundation directly, and then internationally, we're working with CAF America to, you know, manage our grant process nimbly in our site communities around the world. And I've just been really impressed with how responsive and how quickly we've been able to get that up and running with the CAF America team. So I greatly appreciate that, because essentially we're all in this together. You know, I also appreciate this type of forum to share and learn with everyone. And in closing, I just like to thank you all for your time and allowing me to share my experience.
Thank you, Anne and Sylvia and Christine. We now are going to be able to take questions. Please use the Zoom group chat if you would like to ask a question. I have a question to start out for all three of you, and that is, it's very clear from your presentations and the hard work that you've put into this. Obviously, this is really the front line here in the United States. We've seen this global pandemic move around the planet. But to a person, each one of you went back to your own expertise. You went back to your own trusted partners to then build from there the kind of adjustments and the fast, rapid response that you're putting together. What I'd like to do is ask each one of you to reflect on that in terms of what in your expertise helped inform this, what trusted partners helped you move forward, and then wrap that up by sharing with us what you're hearing back from the kind of adjustments and the quick response that you've put together. Can we start with Sylvia Cruz Vargas?
Of course, Ted, and thank you, Anne and Christine, for such moving presentations. I would like to switch the attention of your question to an internal forum we have called the Community Impact Team. And the Community Impact Team is a decision-making body that we have in selective geographies, in which the general manager of our business collaborates with a number of colleagues on deciding who the best partners are to create local impact. Our organization, the PepsiCo Foundation, is relatively small, and we always look internally to those who are in the front line or those who are in country to be able to augment what our business is already doing and catalyze the impact of our efforts. In the case of the particular unprecedented time and the testing times in which we are right now, we went back to our colleagues in China, in South Korea, in Daegu, in Italy, Spain, so many countries around Southwest Europe that have been impacted, and worked hand in hand with our own colleagues to select those partners that definitely are creating a very systemic response on the ground, always staying true to our DNA and the mission of our foundation, as well as the mission of our company, which is in the space of food and beverages. With their input, we have selected an array of nonprofits and provided what I will describe as a hybrid approach. Sometimes we do large grants with traditional enterprises that we have been partnering with since 2001, for example, in China, with the China Women's Development Foundation in response to the original crisis in China. Internationally, in other markets, we were the first ones to fund the Egyptian food bank that was delivering meals to daily laborers in Egypt. And that was also a decision that we took together with our business partners. I think with regards to the best partners, I will say, Ted, there are so many that I don't want to choose one. However, I do want to recognize that the execution of these partnerships require time and effort. And we have been working with your team at CAF America to create our response in a matter of 48 hours or 36 hours. And I know that the vice president of the foundation, the president of the foundation, and the PepsiCo leadership team has been impressed at the speed in which we are working. But that is because we understand our organizations so well, and we know and trust each other, which I know Christine and echo that thought before.
Terrific, thank you. Christine, your expertise, your trusted partners, the adjustments that you've made, bring all that together for us.
Yeah, it's a really good question, and I'll echo a little bit of what Sylvia just shared too, because I think it's a great response. We have been leveraging, again, kind of those trusted networks of in multiple avenues, right? So it's going to the partners on the ground that you've already got relationships with and just gut checking, like, what are you hearing? What are you seeing? What is going on with your clients that you're serving? It's going to our, we have an internal committee also of employee and executive leaders in every different region. We're making sure that we're talking to somebody, you know, in every community that's being impacted, and trying to tailor decisions that we're making to make sure that they're the most community and regionally relevant. And then also kind of layering on top of that, then working with your team, especially in our primary markets, to understand, okay, well, what have you guys heard is the response that you're needing to do. So it's, and then also some of these industry associations. I mean, like online forums have just been, you know, a godsend right now of people being able to get quick information out and be transparent. So I think it is, it's gathering kind of and listening as much as we can, and then trying to say, okay, great. You know, I personally am not deep with the Singapore Food Bank, but I've heard from 2 or 3 trusted resources that they are getting food out and that they are doing it quickly. And so I'm able to act with trust, even though I'm many steps away from that food bank. So I think a lot of it, I hope that answers your question, Ted, but I think a lot of it is thinking about these different avenues that you can leverage to build as much confidence in that you're responding appropriately, while also, you know, just moving at a much faster pace than usually, you know, relationship-based grant making operates. Does that make sense?
It sure does. Anne Velo-Wagner, your expertise, your trusted partners, the adjustments that you're making, help us bring all that together from the Mars Wrigley Foundation point of view.
Sure. And similarly, you know, our approach to our grant making in this situation is hyper local. It's really focused on those local needs in our site communities. And they do vary around the world, and it looks different at different points in time. So when we initially engaged in China, it was really all around the personal protective equipment, and that looked different than what we were hearing in a conversation I had with our team in Indonesia just last week around some needs there. And working with our local teams on site, they are really the feet on the ground and have the insight that we need at this time. We're able to tap into, yes, existing partners, but where that may not be the case, or where there may be some critical needs, looking at it holistically in terms of what the business can then supplement, what they can provide. And there have been countless times where they were able to expedite things at the local level, while the foundation was then looking to mobilize and get the funds for some longer term needs as well. So really looking at it strategically in terms of what everyone can provide, both at the local team level, at the foundation grant level. As an aside, we were about to launch a new grant program in 2020 that we paused because of the current crisis. So that was another example of just being flexible and recognizing that an RFP process was not something we would want to push out at this time, given what the current state of everything is. So I think it's taking that step back, recognizing that it's an all hands on deck approach that's going to be needed for this year.
Terrific. Well, very clearly, thank you, Sylvia Cruz Vargas, Pepsi Co-Foundation, Christine Fontana, Edwards Life Sciences Foundation, and Anne Velo-Wagner, Mars Wrigley Foundation. To a person, you have brought us right into the decision-making boardroom of your foundations and helped us understand how you are reaching out and creating those networks based on the trusted resources that you have, based on the mission and expertise of your foundation. And as you said, in 36 hours and 48 hours, you have been able to reinvent and reimagine the entire process in providing global relief and relief right here in the United States for those who are directly affected by the coronavirus global pandemic. We appreciate your leadership. We appreciate your presentation here today. If we can go to the next slide, please. We do want to share with everybody who is with us here some training that we have coming up. Now, tomorrow, CAF America will be releasing a very powerful study. We reached out to charities who are on the ground providing relief, and we are going to release the survey report tomorrow, The Voice of Charities Facing COVID-19 Worldwide. This is going to really be very powerful. It was mentioned that we have our website, our COVID-19 response page. We have 166 charities on the ground that are already validated and ready for funding. On April 2nd, we have a podcast that will go over the new CARES Coronavirus Relief Act and the new charitable giving rules that are in that law just signed in to act on last Friday. And then on April 3rd, we invite you to join us for our podcast, the Law and Employee Emergency and Hardship Relief Funds. These funds are, of course, extremely important, and for almost every corporation, the desire to help support, as we heard from all of our presenters today, their greatest asset, their employees on the ground who are making a difference, can also be the eyes and ears of philanthropy. So on behalf of all of us at CAF America, I thank you so much. I hope you found this as powerful, as authentic, and providing the insights into the journey that corporations are on. And CAF America remains at service to help you globally and here in the United States for your philanthropy. Thank you for joining us today.